Rubella. Symptoms of rubella. The symptoms of rubella usually take 2 to 3 weeks to develop after infection. This time is called the incubation period. Some infected people won't develop any symptoms, but in those who do, a rash and swelling around the neck and head are common signs of the condition. A red-pink rash. The rubella rash is typically a red-pink color. It consists of a number of small spots, which may be slightly itchy. The rash usually starts behind the ears before spreading around the head and neck. It may then spread to the chest and tummy, the trunk, and legs and arms. In most cases, the rash disappears by itself within 3 to 5 days. Swollen lymph glands. Lymph nodes, or glands, are small lumps of tissue found throughout the body. They contain white blood cells that help fight bacteria, viruses, and anything else that causes infection. If you have rubella, the glands will usually swell behind the ears, below your skull, at the back of your head, and in your neck. In some cases, this swelling can be painful. These lymph glands sometimes start to swell before the rash appears, and the swelling can last for several weeks after the rash has gone. Other symptoms. As well as a rash and swollen lymph glands, people with rubella may also develop other symptoms, including a high temperature, fever. It is usually mild, less than 39 C or 102.2 F, but can be more severe in adults. Cold-like symptoms, such as a runny nose, watery eyes, sore throat and cough. Slightly sore and red eyes, conjunctivitis. Aching and painful joints. Loss of appetite. Tiredness. These symptoms may develop shortly before the rash and usually last for a few days. Seeking medical advice. You should always contact your GP surgery or the 111 service straight away if you suspect rubella. While the condition is usually mild, it's important for a doctor to confirm the diagnosis, as the symptoms could be caused by a more serious illness. If you're pregnant and develop a rash or come into contact with someone who has a rash, contact your GP or midwife immediately. It's also important that any cases of rubella are reported to the relevant local health authorities so they can track the spread of infection in case there's a sudden outbreak of cases. Don't visit your GP surgery without phoning first, as arrangements may need to be made to reduce the risk of infecting others. In particular, contact with pregnant women should be avoided if possible. Rubella can cause serious problems in an unborn baby, although this is rare nowadays. Diagnosing rubella. If you suspect rubella, phone your GP surgery or the 111 service straight away for advice. Don't visit your GP surgery without phoning first, as arrangements may need to be made to reduce the risk of spreading any infection to other people. Contact with pregnant women should be avoided, as rubella can cause serious problems in an unborn baby, although this is very rare nowadays. Your GP should be able to arrange a time for you to visit that won't put other people at risk. You should keep your child away from school, or yourself away from work, until you've seen your GP. Your GP may suspect rubella from the symptoms, but as other viral infections often have similar symptoms, testing a sample of saliva or blood is the only way to confirm a diagnosis. Saliva and blood tests. If rubella is suspected, a sample of saliva from your mouth or blood taken from a vein in your arm can be taken and tested for certain antibodies. Antibodies are proteins your body produces to destroy disease-carrying organisms and toxins. If you have rubella or you've had it in the past, your saliva or blood will test positive for certain antibodies. IgM antibody, this will be present if you have a new rubella infection. IgG antibody, this will be present if you've had the rubella infection in the past, or you've been vaccinated against it. If neither antibody is present, you don't have rubella and you haven't been immunized against it. Diagnosis in pregnancy. If you're pregnant, you should contact your GP or midwife as soon as possible if you come into contact with someone who has rubella. You have a rash or come into contact with anyone who has a rash. You have symptoms of rubella. It's unlikely you have rubella in these circumstances, but a blood test may be necessary to check for the condition. In the rare cases where testing shows you do have rubella, You'll be referred to a doctor who specializes in conditions that can affect unborn babies, obstetrician. You may be offered further tests, such as an ultrasound scan, to check for any signs of problems in your baby. You'll also be offered counseling so you can make an informed decision about whether you wish to continue with the pregnancy if serious problems are found. Treating rubella. There's no specific treatment for rubella. The condition is usually mild and improves without treatment within 7 to 10 days. Phone your GP surgery or the 111 service for advice if you suspect rubella. Don't visit your GP surgery unless you're advised to do so. Treating your symptoms. If the symptoms of rubella are causing discomfort for you or your child, there are some things you can do while you wait for the infection to pass. Controlling fever and relieving pain. If necessary, paracetamol or ibuprofen can be used to reduce a high temperature, fever, and treat any aches or pains. Liquid infant paracetamol can be used for young children. Aspirin shouldn't be given to children under 16 years old. Speak to your pharmacist if you're not sure which medications are suitable for your child. If your child's high temperature is causing them distress, you can also try to reduce it by keeping them cool. A cool, but not cold, compress, such as a damp flannel held to their forehead, can help. Drink plenty of fluids. If your child has a high temperature, make sure they drink plenty of fluid as they may be at risk of dehydration. Keeping hydrated will also help reduce discomfort caused by coughing. Treating cold-like symptoms. If you have cold-like symptoms such as a runny nose, sore throat or a cough, there are a number of things you can do to feel more comfortable. For example, steam inhalation may offer some relief from a cough. This involves sitting with your head over a bowl of hot water. Place a towel over your head, close your eyes and breathe deeply, while trying not to get the hot steam in your eyes. Steam inhalation isn't advised for children because of the risk of scalding, but it might help your child if they sit in a hot, steamy bathroom. Alternatively, putting a wet towel on a warm radiator will release more water into the air. Giving your child warm drinks, particularly ones containing lemon or honey, may also help to relax their airways, loosen mucus, and soothe a cough. Honey shouldn't be given to babies under 12 months. Avoiding the spread of infection. While you have rubella, it's important to reduce the risk of spreading the infection to other people. If you or your child have the condition, you should avoid work or school for 4 days from when you first developed the rubella rash. In rare cases, rubella can cause serious problems in an unborn baby, so you should also try to avoid contact with pregnant women for 4 days from the start of the rash.